Hi, today we have the privilege to talk to Mr. Ridwan, a highly knowledgeable audiologist from Survey Specialist Center Damansara. With a deep understanding of the importance of early intervention and a commitment to improving lives, Mr. Ridwan brings a wealth to the expertise to our conversation. We will be discussing about the red flags for hearing loss in children, the significance of early intervention, the challenges faced and the outcomes, and the positive outcomes achieved through timely identification and comprehensive support to children with hearing loss. Without further delay, let's meet Mr. Ridwan.
When we talk hearing loss in young children, actually you need to think that there is so many possible causes. For the children, there are two types of the hearing loss. We call it acquired hearing loss and congenital hearing loss. Okay, no, most of the kids is congenital hearing loss. Okay, some of them is acquired hearing loss. Okay, I will go for the congenital hearing loss first. For the kids with the congenital hearing loss, normally it will affected by during the birth. There is a high risk baby. Okay, so maybe that kids having the prolonged jaundice, low birth weight. The third one is high risk baby, which is a big baby, which is their mother have the GDM, okay, during pregnancy. And the other one is baby with the high risk of the infection during the pregnancy as well. We call it torches. Torches means that toxoplasma, rubella, cytomegalovirus, herpes zoster, and syphilis. So this is infection during the pregnancy. Okay. The other one is during the pregnancy, mak dia high fever. Okay. So this is the possible cause for the congenital hearing loss. So if there is a history of the one that I mentioned just now, so the mother or the parents should pastikan perkembangan bahasa anak dia tu mengikut milestone yang sepatutnya. It should be for the baby at the earlier 3 months old, dia ada cooing, macam tu. So 6 months old should be got babbling, ba ba ba, ma ma ma. Okay, by the time 1 year old, so dia perlu ada first word, papa or mama or susu or bola, anything. So if parents tengok their child have the maybe slightly delay or delay yang banyak, contohnya umur 1.5 tahun ataupun 2 tahun baru ada first word, so it should be the red flag for them yang anak mereka ni most probably ada masalah pendengaran. They should bring their kids for the hearing test or hearing assessment. The other one is if their kids having the speech with the pelat punya. Pelat maksudnya disebut perkataan tu tak betul. Contohnya kita sebut sound, mereka sebut town, ataupun suka disebut tuka. So this is reflex, right? Okay. The third one, the language daripada kecil sampai umur 1 tahun, 1.5 tahun. Okay, kita tengok ada umur 1 tahun dia ada first word, 1.5 tahun dia ada mungkin dia start ada 2 word sentence. But bila umur 3 tahun dia start senyap, dia tak bercakap. So bila dia tak bercakap, that is a reflex as well. Kemungkinan dia dah ada acquired hearing loss. Maksudnya dia ada hearing loss after dia dilahirkan. Maksudnya umur 1 tahun atau 2 tahun dia ada hearing loss. Okay. That can be caused by the prolonged jaundice. Maksudnya dia jaundice tapi untuk waktu yang lama. Ataupun high fever. High fever pun boleh jadi juga, boleh menyebabkan dia ada hearing loss. So bila dia tiba-tiba kanak-kanak tak bercakap, so that is a flag as well. Dia parents kena take action lah. Our aim is to detect the hearing loss in baby as early as 3 months old. Kalau boleh kita nak expose to them as early as we could. So maksudnya dia boleh dengar bunyi-bunyi yang ada sekeliling dia, and dia boleh simpan semua language yang dia dengar as early as this age. Contohnya maksudnya 3 bulan lah. Okay. So bila kita detect awal, kita boleh make sure the language milestone tu mengikut yang sepatutnya. Macam saya bagi tahu tadi, umur 3 bulan ada cooing, 6 bulan ada babbling, 1 tahun ada first word, umur 2 tahun 2 word sentence, 3 tahun 3 word sentence. So kita boleh ikut proper milestone of the language. Okay. Other than that, dia akan develop their social skill. Maksudnya bila dia boleh berkomunikasi so dia akan boleh meningkatkan dia punya self esteem. So dia punya confidence. Sebab so other than that, dia boleh juga affect education. Maksudnya umur 1 tahun, 2 tahun, 3 tahun tu stage yang memang sangat-sangat perlukan untuk mereka mendengar apa yang mereka ajar. Contohnya parents, cikgu apa semualah. So maybe the babysitter or anything. So if kita detect awal, dia akan banyak boleh improve their life lah, saya boleh kata. Education, language, social and self-esteem, emotion. So that's all. In Malaysia, we already implement the newborn hearing screening. So normally for the patient or baby that born today, it will straight away tested tomorrow after 12 hours of delivery. So we call it newborn hearing screening. So there are 2 types of the test yang kita akan buat, either one lah, OAE or AABR. Ada setengah hospital ada OAE, ada setengah hospital ada AABR. So AABR is more complex and more lebih tepat dia punya result dia. Okay, first I will explain for the OAE first. OAE stand for auto acoustic emission. Okay, this test, it will test up to cochlea, more specific at the outer hair of the cochlea. So the result will be 2 only, pass or refer. Okay, if the patient pass, so it means that baby are having normal hearing, or maybe the hearing will be mild hearing level. Okay, so there will be 2 results for them. So the second one is refer. Refer means that the test is failed. Okay, so for the babies that having refer result, so we will give another appointment date to repeat the test. Okay, if the second test also refer, so we will proceed to the more complex test, which is we call it ABR, Auditory Brainstem Response Test. So kita akan terus slightly buat sebab bila baby tidur, the test result will be more robust. So from the test, we can diagnose whether the baby having the hearing loss or not. The second test is we call AABR, Automated Auditory Brainstem Response. Okay, this one is simplified test for the ABR yang I mentioned just now. It's also test up to inferior colliculus inside the brainstem. This test also will yield 2 results as well, pass or refer. If the test result is pass, means that the patient having normal hearing, no problem. But I will mention that if the baby have normal hearing, doesn't mean that baby won't have hearing loss in the future. There are still the risk for them to have the hearing loss, maybe the acquired hearing loss. Okay, so for the past normal hearing, the second one is refer as well. If the first test is refer, so we will give another appointment for the second test. If the second test is passed, so it shouldn't be a problem. But if the second test is refer as well, so we will proceed with the diagnostic test, which is ABR. But the result for the refer, it doesn't mean that baby having the hearing loss. It can be caused by the debris inside the ear canal. Maybe air ketuban still ada dalam telinga, so masih ada dalam tu, so it's already blocked the probe, so the sound can goes into the ear. So that's why we give another appointment to test again whether the test is pass or refer again. I will start on the 3 months old first. Okay, 3 months old, there is a test we can conduct, which is we call it distraction test. Distraction test is the baby is sitting on the mother's lap, so we will give the sound from the behind. There is we call it a sound level meter. So we give the sound, and if the baby can hear it, they will turn toward the sound. So it means they can hear. So that we can adjust the level of the sound. That test will give us some idea the hearing level of the patient. The second one, for the 6 months and above, the test is we call VRA. VRA means that visual reinforcement audiometry. Okay, this test is need the special equipment for them. We put the speaker at the side, and then the patient will be sit at the middle. We will give the sound to them. If the patient can hear the sound, they will turn their head towards the sound, and we give some reinforcement for them, like a toys or anything. So from that, we can diagnose the hearing level of the patient. Okay, for the 3 years and above, we will do the play audiometry, which is we modified the test that we use for the adult, but we modified it for the kids. which is we play during the test. We give some Lego or anything, so if they can hear, they can put or they can stack the Lego or anything. If we already attempt with the behavioral test but we cannot succeed with that, we will proceed with the ABR, which is auditory brainstem response. This one, if the patient cannot stay still, we will sedate them. The doctor will prescribe the sedation, and then we will run the test for the both ears. So the test will be, we put the electrode at the head and at the earlobe and at the back of the ear, and we will present the sound to the ear, and the electrode will pick up the response from the brain. So we call it ABR test.